depending on the type of surgery that you've had, you may go home with drains. These drains are placed after the surgery is complete under the skin to help collect any fluid that accumulates. This is what the drain bulb looks like. This portion is inside of the patient. So you're going to have about this length of tubing that you're going to be able to play with. So what happens is the bulb is compressed like this, and this is what it looks like. It sucks out the fluid gently. So this is always under continuous pressure. You want to make sure that it's collapsed upon itself. So what you're going to do is when you go to empty it, you're going to empty them 4 times a day, breakfast, lunch, dinner, and bedtime. You can even time it if you want to do 8, 12, 4, and 8. We're going to send you home with this drain sheet, and you're going to date it and time it and write down how much comes out of each drain, because sometimes you'll have up to 4 drains, sometimes even more depending on what surgeries are being done. The drains will be numbered so that you can correspond with the numbers on the drain sheet. Bring this drain sheet with you to the post-op appointments because that will determine which drains get pulled when. So what you're going to do is, this is connected to you. You're going to open the plug. It will expand. You're going to measure how much is in here. There's numbers on here, 25, 50, 75, and 100. Measure how much fluid is in here, write it down, and then you're going to empty it out into a container. That fluid can go down the sink or toilet. And then what you do is you squeeze the bulb and put the plug back in, and that's what creates the suction. You can milk the tubing as well before you drain it. So what that looks like is you're just going to hold one hand, say the drain's in the breast. Hold it close, and you just want to, you're going to have 2 hands. You're just going to make sure that you're not pulling from the incision site. So keep one hand steady and pull down the drain like this. And that's just going to help get the extra contents down into the drain before you empty it. Now, if the drain fills up really quickly, give us a call right away. That is something that is not good, especially if it's dark red clotty blood. Give us a call right away. It should be more of a bloody tinged, watery fluid in there, and it will slowly decrease in color as the healing occurs. So it'll start out red, it'll turn to like a light red, a pink, and then it'll start turning more yellowish. That's the normal progression. If you're progressing down and then all of a sudden it's dark red clotty blood, give us a call right away. And it should be a slow, gradual fill up.